One of the health issues Peaks of Health Metabolic Medical Center specializes in is hormone therapy. And here to tell us what they offer is Medical Director Dr. Tracy Lionheart. Welcome, Tracy. Glad to have you back on our show today.
Well, it's good to be back.
And hormones, I mean, just kind of this all-encompassing term that kind of dictates so much in our life. How can you help? When do you know when to help?
Oh my God, it is huge, you know, because we always think of hormones as estrogen, progesterone, testosterone. And most people don't realize hormones are chemical signals that tell the body what to do. So it tells one part of the body to do something else. So if they go awry, it really can mess up the person. So even cortisol is a hormone, insulin is a hormone, thyroid is a hormone. So it's that symphony that we try to get interconnected to work. So if one piece of the instrument of the symphony is not working, you don't have a very good show.
And since we've been able to spend some time together beforehand, it seems like getting to know your practice, you don't just look at one hormone, you're going to look at a person and kind of take a look at everything going on.
We do look at them. And, you know, a lot of our patients, you know, can be women and men from all ages. We have young men with low testosterone these days, which, you know, can be from infection or stress or traumatic brain injuries. These young kids who play football, we find that years later, they start having problems in their 20s. We find young women with what we call premenstrual syndrome, severe periods and PMS. Lots of times that's a hormone problem. We find women after they have birth, you know, that have postpartum depression. That's a hormone problem. And then we have our 35-year-olds going into what we call perimenopause. You know, they start declining their hormones. Well, that's their highest risk for breast cancer because those hormones are disconnected. You have really high estrogens and low progesterone and testosterone. So you lose your protection. You know, and then we have our menopausal women. I mean, those are the ones who usually come in hot flashing and like sweating and in a lot of trouble and really need to be fixed quickly.
That's exactly what I thought of when we were going to talk about this segment. I'm thinking, oh, we're talking about menopause, but this is so much more than just menopausal women.
It is. It's women and men. We have a lot of men these days that because of stress or whatever else or, you know, other causes, they are getting really low testosterone levels and they play a huge role in their brain function, their mood, their ability to, you know, heal and their ability to, you know, work.
So, you know, if people are at home watching, when do you know, like, yes, this is the time to pick up the phone versus, no, I'm going to try to battle through on my own?
Well, again, if you're having repeated problems, you know, especially, I don't think any woman or man should have to go through the change life. It wasn't a problem when we lived to be 40 or 50. We're living to be 80 or 90 now. You know, I don't know about most people. I don't want to be in a nursing home in a wheelchair at 90. I want to be on a tennis court playing my game, you know, so it plays a big role in osteoporosis, heart disease, brain health, Alzheimer's. You know, Alzheimer's is linked into low testosterone and low hormones. Estrogen plays a huge role in females for their brain function. You know, I want my brain sharp as a tack. I don't want it, you know, especially with what I do, it needs to stay sharp as a tack. But, you know, a lot of our women complain that they can't think right, they're forgetting things, they're having slips and falls, or they're, you know, they're a little off balance. These are all parts sometimes of those hormone changes.
Now, what about treatments? We've established that there might be a problem. They spend some time with you. What are some of the treatments that you are able to dispense?
Well, again, it completely depends on that person because we measure those levels, and whether it be thyroid or whether it be correcting their insulin levels or whether it be their stress hormones or whether it be their actual progesterone, testosterone, pregnenolone. Pregnenolone is a hormone most people forget because it's the brain hormone. This has studies showing that low levels are high risk for Alzheimer's disease, low levels are high risk for dementia, and if you do have a stroke or an injury, you have a worse outcome when that is low because it's that mother hormone to the brain. So it's putting all that together, and again, sometimes it's replacing those hormones. We only use bioidentical in our practice. I don't use synthetic hormones. But there's many ways to do it. You can do it by creams, you can do it by pills, you can do it by patches, you can do it by injections, you can do it by pellets. So there's a lot of different methods where you can replace those hormones.
Well, in fact, one of our guests in a previous segment actually overcame diabetes because of some hormones, correct?
Exactly. We were working on his insulin hormone and his testosterone, because testosterone in men, every single one of my diabetic men is low in testosterone. Testosterone is what causes insulin sensitivity in the muscle. So when it's low, you become insulin resistant. So they go hand in hand. So in order to correct one, I have to correct the other.
Interesting. Wow. You guys sure do a lot there, Dr. Tracy, but thank you.
You're welcome.
We appreciate you coming in and breaking it down for us. And there's a lot more information, good information about hormones and other health issues at peaksofhealth.com. And in fact, they do offer a 15-minute free consultation for our Morning Blend viewers. There's their website and phone number for you to check it out.